Hi, I'm Laura Siminoff, Dean of the Temple University College of Public Health. And the faculty experts with us today are Graciela, Jaschek, Sarah Bass, Krys Johnson, and Heather Murphy. And so things are happening pretty rapidly in some states, including Pennsylvania. We're definitely having a surge even as we open up. Things are looking a little better, but we still have a lot of cases here. On the other hand, many Americans are fully vaccinated, maybe around 40%, maybe a little less, and a good percentage are partially vaccinated. So on everybody's mind is, what's the point of being vaccinated if things are still closed and we still have to wear masks? So let's talk about the latest CDC guidelines and how vaccinated people should be navigating their environments. So Krys, maybe let's start with you.
Yeah, so CDC has this really helpful visual to help people understand what their risk is in different situations. So first off, to clarify, when we say fully vaccinated people, that includes only folks who are 2 or more weeks past their final vaccine shot. So just to clarify, it doesn't mean you just got shot number 2. You have to wait for it to actually react within your body. But those who are fully vaccinated can interact with vaccinated or unvaccinated folks indoors or outdoors without masks, and can visit with unvaccinated people like grandchildren from one household without masks. Now, that said, whenever we get to multiple households, maybe you're having some sort of holiday dinner, well, that should either be outside or you should still be wearing a mask just for those kinds of situations. But also, to be clear, if we're looking at attending a crowded outdoor event, so think about our concerts, graduations, outdoor sporting events like Phillies games, then you should still be wearing a mask at those events, even though they're outdoors. So that includes amphitheaters and things like that. So pretty much indoors, you should still, as a fully vaccinated person, be wearing a mask anytime you're in shared space with people from multiple households or people that you don't know. So that remains the same. But some of the guidance around having to be tested before and after you travel and having to quarantine and all of that, that doesn't apply to fully vaccinated folks. And if you're fully vaccinated and you don't have to participate in routine screening if you're asymptomatic. So that said, again, you should be vaccinated or be wearing a mask as a fully vaccinated person anytime that you're indoors with large amounts of other folks. So this can be weddings, or just large family events themselves, and making sure that you still get tested if you do have symptoms of COVID-19, because we do know about between 5 and 10% of people who are fully vaccinated still can become infected, but most often they can't infect other people. So that's still something we need to look out for. So that's kind of a rundown on what the updated guidance is now for fully vaccinated people. The guidance for unvaccinated people really remains the same. You see a lot more yellow and red here on this end to indicate the level of safety or unsafety.
Okay, so what do people think of those guidelines? Like, if you're fully vaccinated and you're outside attending an event and there are people who are vaccinated and unvaccinated and everybody's not wearing a mask, how would you feel about an event like that? Would you feel comfortable?
I was actually in this situation this weekend, and it was my daughter's prom, and they were taking pictures out at a park. And some people had masks on and some people didn't, and we were with families that were fully vaccinated. And I must say it was weird at first, because we have become so conditioned over the last year to be wearing them. But then we realized, based on this guidelines, we could be without these masks in this open air area. And so you start to feel a little bit more normal, I guess. But it is still kind of in the back of your mind. And I think it is hard to know for sure who isn't vaccinated, obviously. And so that always is kind of odd, I think. And I must say then after that, you do start to feel like, oh, well, I don't have to wear it. And I think that can be kind of problematic for some people too, because then you have to start thinking about not only do I put it on, but is this a situation where I have to have it on, or can I have it off, or, you know, and so that becomes kind of complicated, I think, for some people. And I think it just kind of drives that whole feeling for a lot of people that, you know, we just are making this stuff up as we go.
Right.
Well, I want to add something to that. I was outside with a group of people, and then we were discussing about, well, we are all fully vaccinated. Do we feel still comfortable wearing or not wearing masks? And it was really interesting because we all said, now that we are fully vaccinated, it's like a weight was lifted off our shoulders, and we feel reassured that if we get infected, because the vaccine is not 100% effective against getting infected, but if you get infected, you are not going to develop severe disease, get hospitalized, or die. So that's the weight of our shoulders. On the other hand, we were saying, well, you know, we still don't know with the variants how effective vaccine is. I mean, we know from some studies that it's effective against some of the variants, but not so with other variants. We also were talking about, well, there are immunocompromised people or immunodeficient people, and we don't want in any case contribute to the spread of disease. The other thing is that we still don't know if once we get vaccinated, if the spread of disease stops, or how effective is the vaccine at stopping the spread of disease. So some studies are starting to indicate that it cuts down on the spread. Once you are fully vaccinated, the vaccine cuts down on how much you spread COVID-19. But still, I think you need to think about, because the vaccine is not 100% effective, you still have to worry about spreading the disease, getting infected. But the spread, this is why we need to take precautions, because we want to stop that spread. The more there is, the more the virus spreads, the more there is a probability that new variants are going to start popping up. And so I think that, you know, taking precautions, getting fully vaccinated and taking precautions is really good, no matter what.
Yeah, I want to add too about, like, I have little kids and they can't get vaccinated yet. And I don't care if they're around people who have been vaccinated, because they could still potentially carry the virus and give it to my kids. And so for me, I want them to continue to wear their masks, and then I'll lead by example. And when like fully vaccinated, still wear my mask. So I don't know, I'm really hesitant with kids, and then they need to adhere to those guidelines probably in school again. And if all the adults are running around with no masks on, well, what kind of lesson are we teaching our kids? And they're not going to follow that either.
What about restaurants? I love restaurants, but I just see eating in a restaurant as like one of the most dangerous things you can do. And yet, really, for economic reasons, they've opened up indoor dining, even in Philadelphia, like around half capacity. So if you were fully vaccinated, what do you think about people going to restaurants? Because maybe if everybody was fully vaccinated in the restaurant, but we have no idea, you have no idea whether the person next to you is vaccinated or not. I mean, I would personally not go and eat inside a restaurant unless I was the only person there. And even then, I don't know what the wait staff, I probably wouldn't do it at all. But what do you all think?
I would totally agree with that. I would not feel comfortable at all because you don't know what other people are carrying. And I have the example of my next door neighbor 2 doors down. He got vaccinated against COVID-19. All his family, his children got COVID-19, infected with COVID-19. Once he got the first vaccine, he thought, well, I am okay. So he continued sort of interacting with his family friends. He was sort of social distancing and sometimes wearing the masks and all that. But then he got the second dose and 2 days later, he came down with COVID-19. And so, but, I told him, well, probably you are not going to end up hospitalized. He has underlying conditions. You are not going to die. You are not going to have, be hospitalized. And sure enough, 2 days later, he went out golfing, but he felt very lousy for 2 days, like a bad cold, he said. But that's to show that even if you are vaccinated, you can get infected. And that's part of the problem. Sometimes when people get the first dose, they feel like I am protected, but full protection comes 2 weeks after the second dose. So be aware of that and don't feel like my neighbor, it's okay to interact with people who are infected with COVID-19 because you may get infected.
I agree with you, Laura and Graciela. I'm not eating indoors at all right now. Now that said, I do take out a lot from local businesses to make sure that I'm still giving them business and still tipping people appropriately. But I'm not to the point where I feel comfortable being indoors with half capacity of folks. So even I went and got my hair done this weekend, which is something that we can do, visit a barber or hair salon. And I did do that fully vaccinated, like I'm fully vaccinated, wearing a mask, 2 masks in fact. And I found out that each of the stylists that was in there was fully vaccinated, and each of the people that came in to get their hair service was fully vaccinated. So that's kind of setting where you're talking to each other and you find those things out. You don't do that in a restaurant to be able to feel comfortable. And in a restaurant, you by definition have to take your mask off. So that's a more risky situation anyway, even for fully vaccinated people. So that's still not something that I would do, even as a fully vaccinated person.
And Sarah, I want to ask you, so I feel that because if everybody who's not vaccinated takes their mask off in public, I feel like everybody will, whether they're vaccinated or not vaccinated. And it may be okay when you're in a big outdoor space, but I worry about crowded outdoor spaces in cities. Even, if you were even if you're walking like in like Center City or whatever, it can be crowded. People can jostle each other, be right on top of you. And I worry that, the unvaccinated will just say, oh, okay, I don't have any pressure now to wear a mask, so I just won't.
I think that's right. And I think it plays into a lot of, the inherent problems we've had with communicating in a real-time pandemic as guidelines change, as we learn more about, the virus. And, at the beginning it was wipe everything down with Clorox. And, now we know that this virus is really a respiratory virus and that's not as important as wearing a mask. And so all of that changing information, I think, feeds into a lot of this feeling of, well, if they don't really know what's going on, then why should I get vaccinated against something? And I think you're right that it gives in some way license to not do things like wear a mask, because we're not all walking around with a big V on our head to say that we're vaccinated or carrying our cards around showing people. And so it does allow those who maybe are more inclined not to get vaccinated to say, well, I can blend in now. You know, it used to be much harder. If you saw somebody who didn't wear a mask, you knew that they were intentionally not wearing a mask for whatever reason. Now it's a lot of us may not be wearing a mask, and they are, then that gives them the okay to not wear that mask either. And so, you know, what the consequence is going to be, I think, on actual vaccination rates, I'm not sure. I think it's going to be very interesting in the next probably 4 to 6 weeks to see if we do continue to see this kind of steady decrease in the number of people who are getting vaccinated. So it was easy to get to that kind of halfway mark.
Right.
But, you know, this extra 25% or so, I think are going to be really, really tough.
I agree. So I just want to go around to everyone as we wrap up and ask you like what you would recommend to people around these CDC guidelines. I'll start with Heather.
Well, I was going to ask a question almost back to you guys about the guidelines, because do you think the CDC's made them so that it incentivizes people to vaccinate and might be pushing limits as to really what we should be doing? Like, one thing that really sticks out is not getting tested before getting on an airplane, getting into a really small confined space, even if you've been vaccinated. And to me, that just is the wrong thing to do. But I think maybe they're trying to give people a break, or if you're vaccinated, these are the perks that you can now do. But for me, I think that the CDC guidelines, I think they're great as a starting point, but to me, I would be more vigilant than even what they've proposed. Like, I would be more careful.
I would definitely agree with that, Heather. I think that they are trying to incentivize vaccines because people are we're plateauing the number of people who are getting it, which is, I mean, we all need that incentive, that light at the end of the tunnel. That makes sense. But I think the message to people should be, do what makes you feel comfortable. If you still feel comfortable wearing a mask in these situations, absolutely do that. You don't have to go maskless just because that's what the CDC guidelines are. You don't have to agree to meet with your family indoors just because that's what the CDC guidelines are. Still maintain whatever makes you feel comfortable in protecting yourself as an individual.
I think that I would say still take precautions. Fully vaccinated, not fully vaccinated. Particularly if you are fully vaccinated, you have to provide an example. And we are in public health. So to me, it's like I tell my students all the time, walk the talk. You are in public health.
Yeah.
So show that you are an educated public health professional. And anyways, we are already accustomed to wearing the masks. So what is it? You can continue doing it, and you can continue social distancing just to protect others until we know more that this pandemic has been, I guess, conquered. Although I think the coronavirus is here to stay, and we are going to deal with it over the years, and we'll need a vaccine like as with the flu virus. But continue taking precautions. I think that we lived with them for 1 year, we can live with them for another year.
Any other thoughts, Sarah?
I guess, you know, the last thing I would say is that I think what CDC is trying to do is reframe the discussion around masks to be a carrot rather than a stick. And that, you know, people don't like a stick too much. And so this is a way to try to reframe that discussion of, if you get vaccinated, then this is like Heather said, this is the perk, you know, that you don't have to wear that mask all the time. But I do think that it sets up a precedent for everyone not to wear a mask, and then that becomes problematic.
I think that the CDC hasn't thought through the psychology of this.
Yeah.
Clearly. I think that in order to incentivize people to get vaccinated, it's more than just, but if you get vaccinated, you don't have to wear a mask, this, and that. Since there's no way for anyone to know, actually, sadly, I think we need actual cards that, like real cards that you could swipe or whatever, that say, I've been vaccinated, I can get on a plane, I can do this, I can do that. Without it, we just have a bunch of, you know, to use a term that they use in health insurance, free riders. So in any case, we'll see what happens. So thanks so much for joining us today. I hope you'll view some of our other videos and find links to reliable sources of information on our website at cph.temple.edu/coronavirus. Thanks for joining us.